Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is very made clear and often illustrated. Let's start. Today's topic is Non-Hodgkin lymphoma. There's a new review about the different type of Non-Hodgkin lymphoma. The classification is difficult and complex. We will highlight the essential point of each category. We will deal successively with low-grade lymphoma, intermediate lymphoma, and high-grade lymphoma. Low-grade, in this category, there is 4 types. Small, 4 types. Small lymphocytic lymphoma, mycosis fungoid, follicular lymphoma, and extranodular lymphoma. Intermediate, there is 2, diffuse lymphoma and follicular lymphoma. High grade, there is 5, lymphoblastic lymphoma, adult lymphoma, Sezary syndrome, small non-cleaved lymphoma, and immunoblastic syndrome. Low grade, small lymphocytic lymphoma, mycosis fungoid, follicular lymphoma, and extranodular lymphoma. Intermediate, only 2, diffuse lymphoma, follicular lymphoma, large cells, and high grade, lymphoblastic lymphoma, adult T-cell lymphoma, Sezary syndrome, small non-cleaved lymphoma, and immunoblast syndrome. Low-grade lymphoma. The first one is small lymphocytic lymphoma, SLL. It's B cells like chronic lymphocytic leukemia. It's associated with Waldenstrom IgM disease. I repeat, small lymphocytic lymphoma. It's associated with the B cell. It's like chronic lymphocytic leukemia and associated with Waldenstrom IgM disease. Chronic lymphocytic leukemia, think about lymph node, hepatomegaly, splenomegaly, and extension to the blood. Waldenstrom, think about immunoglobulin type M, IgM. There is a peak of immunoglobulin. Mycosis fungoid, it's linked to T cells, chemo-dependent. Mycosis fungoid, macule, and patch. Follicular lymphoma, it's small cell, it's cleaved. There is a translocation between chromosome 14 and 18. It's linked with B cells, and there is apoptosis gene at BCL2. Extranodular lymphoma, it's linked to mucosa-associated lymphoid tissue. Think about Malt, mucosa-associated lymphoid tissue, the island of Malt. Grade intermediate, there are 2 types. The first type is diffuse lymphoma. It's a mixed between B cells and T cells. It's a most common of Non-Hodgkin lymphoma. The second type is follicular lymphoma. It's a large cells linked to the translocation between chromosome 14 and 18. High-grade lymphoma, LACI. L stands for lymphoblastic lymphoma, A stands for adult lymphoma, S stands for Sezary syndrome, S stands for small cell no-cleavage lymphoma, and I stands for immunoblastic syndrome. Lymphoblastic lymphoma, it's linked with T cells, teenager, and leukemia. TTL. T cells, teenager, leukemia. Adult T cell lymphoma, think about Japan, high calcium, and there is linked to a virus, HTVL1. Sezary syndrome, it's an aggressive form of mycosic fungoid. Mycosic fungoid, think about macula and patch. Small no-cleavage lymphoma, think about Burkitt lymphoma, African child with swelling of the jaw, linked to Epstein-Barr virus, translocation between chromosome 8 and 14, starry sky of macrophage, and CMYC oncogene on chromosome 8. The last one is immunoblastic lymphoma. Don't forget LACI, L, A, S, S, and I. Let's review. Low grade, intermediate, and high grade. Low grade, there is small lymphocytic lymphoma. Think about leukemia and Waldenström, mycosic fungoid, follicular lymphoma, and extranodule lymphoma. Think about Malta, the island of Malta. Follicular lymphoma, think about the translocation 14-18. Intermediate, two form, diffuse lymphoma, mixed between B and T cells, and follicular lymphoma. It's in low grade there is follicular lymphoma. In intermediate grade there is follicular lymphoma, but with large cells. Here small cells, here large cells. High grade, think about LACI, lymphoblastic lymphoma, adult T cell lymphoma, Sezary syndrome, small no-cleavage lymphoma, and immunoblastic syndrome. Small no-cleavage lymphoma, think about Burkitt syndrome, tumor, lymphoma. Sezary syndrome, it's a malignant form of mycosic fungoid. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.